Hello, good afternoon, good evening, good morning and welcome. My name's Richard Ishwood. I'm a registered nurse. Clinics in the UK is called Normal Earwax. You might have, welcome to episode 82. You may have noticed on the way in, you could have seen something on the patient's tragus. Now that's that little bit there, the little bobbly bit just outside the ear. Got an image of it after. The answer is, if there's a question of what is it, the answer is I don't know, is the honest answer. I have a few ideas. I'm not a dermatologist, it's more of a dermatological thing. This could be a congenital thing, it's been there for many years. Doesn't give the patient any symptoms, but always worth getting checked out, which is why I've sent some images of this away to the specialists. Now, that wasn't the reason why there was a problem with the gentleman's ear. It was obviously all this inside, which was a fair amount, but you can see it there again, can't you? It did present us with a bit of difficulty because you have to navigate around this. Now, normally you have to navigate sometimes around the tragus, but because you've got that big bump there, it makes it even trickier, and obviously you don't want to catch it on the way in, so it did make it pretty tricky. The procedure itself wasn't too difficult, apart from that getting in the way. Tried to get it out first without any oil, but didn't really get anywhere pretty quick, so what we decided to do was bung a load of olive oil spray in there, and as you can see, it's made it a lot more moist. Sorry if there's people who don't like that word again. Yeah, someone said the only thing that should be moist is a cake, and I do agree. Not sure on the chocolate cake though. Victoria Sponges or buttercream cake for me. Anyway, I'm getting distracted, I'm also getting hungry, so I need to finish this so I can get something to eat. Let's talk of food. You'll find a lot of nurses are obsessed with food and the bellies. It's because they don't really get a break, so you've got to make the most of it when you get it. Never trust a skinny nurse, I was always told. Reason for that is, if they're a skinny nurse, they're clearly not a very good one, because they don't get given presents of cakes, chocolates and sweets from their patients. So obviously a really big one, you know, she must be an amazing nurse, or he. But yeah, I'm an averagely sized nurse, so I wasn't bad, I was okay. Now, it has helped somewhat, this oil. I think it just got a little blocked up there, and again, it just make it a bit blurry, which is nothing I can do about, unfortunately. I'd be in and out of the ear every couple of seconds, trying to wipe it, but if you can see well enough, then, you know, it's absolutely fine to carry on. But it did help me to get slightly better grip, the oil here, and it certainly helped it when it came to sliding it out. So I'm just trying to grab it from the bottom there and lift it up. And if you're listening to the sounds, you'll hear there's still a slight hissing. That's obviously the air passing up the suction tube. As soon as you hear that stop, then that's when you know there's a flat seal on the plug. I'm not trying to get a flat seal at the moment, I'm just trying to lift it up from the bottom. So it's kind of half blocked at the moment, so we're just trying to lift it. And then as soon as you hear the sounds go, I think it might be any minute now. There you go, stop making a noise then. So that means you've got your full seal, and that's when you can start pulling it out. But tricky this, because I think I dropped it again, as per usual, because I was very cautious of catching this thing on the way out. You know, if you don't know what it is, you certainly don't want to catch it or make it bleed or irritate it in any way. So I was very cautious as I was pulling it out past that, which because of that growth, there wasn't much room, obviously. Just about managed to squeeze that past it. There you go, you can see it there, can't you? And having to navigate underneath it and then get up. Again, joys of having an endoscope, this. This will be very tricky any other way, this. So there's just a little bit left there at the roof of the ear canal. A few little bits around the edges, decided to leave those because you need a little bit of earwax in, it's good for you. And there's the eardrum, could notice a big difference straight away. And if you just hang on a second, I've got an image of this, there it is. So, like I said, it's not my job to diagnose what things are, what they may be. I have a few ideas, but this is why you send to the specialists. You obviously rely on them to come up with a diagnosis and see if they think it's worth doing anything about. But I hope you found that interesting. I hope you enjoyed it. But for now, take care of yourselves, and I'll see you soon. Take care. Bye-bye.